welcome to You Didn't Get the Memo Show. I'm your host, Gloria Bailey Ray. As always, you guys, we got a great show today, and I want to apologize somewhat. Sometimes a girl got to take a little time, and I know that Tuesdays, you guys are so accustomed to the show happening on Tuesday, but nonetheless, that does not take away from the caliber of guests that we have on. And just due to a scheduling change, we're now having a show today, but next week we're back on Tuesdays. All right. So I want to welcome you guys to You Didn't Get the Memo Show. For those of you who are new, You Didn't Get the Memo Show is about providing you, the viewer, with relevant, fact based, mainstream information to help you be informed and to make informed decisions. Now, today we're doing something a little different. We have different people who come on and they've talked about different things, but I thought it was interesting and important that you guys get your questions answered about a lot of stuff, because so we're kind of like, it's a cornucopia of all types of things today that we're going to be talking about with my guest, but she is more than qualified and able to handle the different questions and the different topics and things we're going to talk about. But let me tell you a little bit about her profession. My guest today is a certified physician's assistant, and physician assistants are medical professionals who diagnose illnesses, they develop and manage treatment plans, and so much more. And she's going to tell us a little bit or a lot about what the so much more is. But listen, some of you may have dealt with within your healthcare system a physician assistant, but I want you to really understand what they bring to the table. Now, employment of physician assistants is projected to grow by 31% by the year 2030. And that's much faster than all other occupations. So think about that. So for those of you who are kicking off, starting college, not quite sure what you want to do, but you like the medical profession, you might want to really give some serious thought to becoming a physician's assistant. Now, from a budgetary point of view, physician's assistants are in very high demand, according to the American Academy of Physician Assistants. And why is this? Not only because the physician's assistants are attractive, but you know what? It's a more cost-effective manner to utilize a physician assistant, and they are quite appealing because they're a little softer on the budget. Okay, in healthcare facilities. So today, my guest is Miss Ebony Tinsley, and I want to welcome her to the show. Hey, Ebony,
Hello,
welcome,
Gloria. Good
welcome.
to see
Good
you.
to see you. Thank you so much for being here with us. Like you heard me say, we're going to talk about a lot of different things, and I know that people have questions and comments. And by the way, you guys, this is a very interactive show. So if you have questions for my guests, please place them in the comment section. We'll do our very best to respond to you. So let's kick it off with just asking my guest, Miss Ebony, talk to us a little bit about what's your backstory. Everybody wants to know what's the backstory. So let's start with that. How about that?
Well, I am a Bay Area native, born and raised Richmond, California. I went to Salesian for high school, undergraduate, Xavier University of New Orleans, HBCU Love. I have my master's in biological sciences from University of Pacific in Stockton, California, as well as my master's in science in physician assistant sciences from Lake Erie College in Painesville, Ohio. I am currently in my fourth year in practice. I work in primary care, family medicine. Love what I do. Blessed to be here, and definitely enjoying the career choice that I made. I kind of started off in medicine as a candy striper. If any of you are familiar with the Brookside Hospital in San Pablo, California, this hospital was a public community hospital. I started as a candy striper about age 14. Loved the sort of my volunteer role. I continued on, got into a bit of research in undergraduate, working with one of my professors who I had taken a course with, then continued on to go into a year of research at the LSU Health and Science Center in New Orleans, Louisiana. That's where I got my first published piece in April of 2009. Then I went on to get a master's in biological sciences, where I continued to do research focusing on DNA damage repair and working with genes that are also associated with BRCA2, the breast cancer gene. Once I became a PA, I started off in orthopedic surgery, occupational medicine, and then finally transitioned into primary care family medicine, which I am currently in now.
Wow. Well, listen, first of all, just the fact that you're talking about biological genes, I'm like, all right, I knew you were heavy. But my sister, I'm like, oh my goodness. Yeah, okay, all right. Which is why I want people to know that it's no joke being a physician assistant, right? And
Absolutely.
the fact that, did I hear you say you have a double master's? You double
Yes.
mastered. And that in itself, look, for me, one master's was more than enough. So my hat's off to you. I tip it to you because it's like, that was like the longest 27 months I could ever even have imagined. So um, thank you for sharing that, and I love hearing that. You talk about candy stripers. I don't even think they do that anymore in the hospital. They need to bring candy stripers back.
They really should. I mean, volunteer services, medical healthcare in general right now is in need of additional services, additional help.
Hmm.
I believe now they don't call them candy stripers. It's just you're a volunteer at the hospital.
Okay. All
Um,
right.
yeah.
Okay. Awesome. All right. So let's talk about. Let's start with, first of all, even though you had all these degrees, but are physicians assistants licensed?
Yes. So we are licensed through the Physician Assistant Medical Board. You are licensed in individual states. So I'm licensed in California. I can also be licensed in other states. So that's an option as a physician
Mhm.
assistant. So if I chose to do any sort of like travel medicine where I'm working in, let's say, the state of Texas, New York, I can become licensed in those particular states as well as still being licensed in California.
Yeah. Um, and I would imagine that just going through, I know what it was like going through my nursing boards. So, as a physician assistant, because basically what you've done, I know we're going to talk about this because there's actually a lot of people basically see you on that level. As a physician, you're able to diagnose, treat, set up treatment plans, do all of these things. And that's an awful lot. So, the fact that you're able to be licensed and I can only imagine that would for me would probably have to be a double bottle of wine at this point.
Red or white, red or white.
Look, how about both? One of each, one of each for sure. But that red chocolate,
Yeah.
that's the kickers for sure. So, with that being said, I asked you before we came on, a lot of people refer, and I guess it's a personal preference, that as physician's assistant, some people want to be referred to as doctor,
Mhm.
whatever. Some people say, no, call me, by their first name, or call me, by my last name, Miss Doctor. So what are your thoughts around, titles and that type of thing? Because I would suspect that the people who are feeling like if you don't refer to as a doctor, that they don't see as much of a value in what you do as a physician's assistant.
And that is a really good question. A lot of my patients, they want to know what to call me. And I'm pretty laid back in that sense. You can call me Miss Tinsley, you can call me Ebony. A lot of my patients call me Dr. Tinsley. I've gotten out of the habit of correcting. I'm like, hey, just call me Miss Tinsley, just call me Ebony. It's more or less whatever the patient feels comfortable, and we kind of come to that agreement. But patients, they call me Dr. Ebony, they call me Mrs. Tinsley. It just varies. But The C on at the end of PAC just means that you're certified, meaning that you have passed your medical boards, you're licensed, you are within your realms and requirements. So that is the only importance in regards to that C.
Hmm. Oh, okay. Absolutely. And I just like the idea of saying doctor because all of the school and training, see, people, that's why I wanted you to talk about that up front. The type of training that you go through and what you do, it there is so much, which leads me into the question of talking about, what are some types of things that a physician assistant does do. You're working in an office, they're physicians and they're slammed, and of course, it's like really and truly they have less than 5 minutes to walk in, say how you doing, make a diagnosis, write a prescription, and walk out the room. And I think it's very different with a physician's assistant. So what types of things do you do as a physician's assistant?
So, as a physician assistant, you are working under the supervision of a physician, so either an MD or a DO. You cannot work independently. You can work autonomously, meaning that in primary care, I have my own patient panel who I am the primary care provider for. But I do have a supervising doc that is on site. Should I need to gather information from her, get advice, things like that. Physician assistant is very unique in that we learn by the medical model. So it's basically like taking medical school and cramming it into 27 months, 2 to 3 years, depending on your program. So you learn by that model, whereas with a nurse practitioner, you learn by the patient center model and you have to specialize. Physician assistants, we work in all different aspects. It's a lot of flexibility. So again, like I mentioned, I've worked in orthopedic surgery, occupational medicine, and I'm currently working in primary care. I can go and work in any realm of medicine, OBGYN, cardiothoracic surgery, those sort of things. You pretty much do everything a doctor does. I have my own DEA license. So I'm licensed to prescribe controlled substances, medications, and that is the caveat to having that master's degree, because you need that master's degree in order to prescribe medication. Now, when it comes to patient care, where I currently work is we work in a collaborative effort. So we see each other's patients. So I see some of my MD provider or colleagues' patients. I see some of my nurse practitioner patients. I see a variety of patients. And I see, as we say in family medicine, from the womb to the tomb. So I see little babies, I see patients that are in their 90s. I manage chronic conditions such as diabetes, hypertension, high cholesterol. A lot of what I do currently is doing a lot of physical exams. So people during the pandemic, of course, didn't go see their providers regularly. So now we're kind of playing catch up, getting patients back on schedule with their annual colonoscopies, mammograms, things like that. That's pretty much I do a wide variety of things currently, especially with primary care and the demand.
Mm, wow, a lot of things. I'm like, whoa, okay. So you guys, you wondering, should I not? You just heard, you know, Ebony say that she does just. I mean, that's really interesting. All the different types of patients that you see, and the kinds of things. And so this is why I want people to have the utmost confidence in why when a physician assistant come in, and I'll tell you my own personal story, after the break. But you know what? When we come back, I would love to hear you talk about. We're going to get into Roe versus Wade because I know a lot of people want to hear your thoughts on
Absolutely.
that, and I just know you've been dealing with a whole bunch of that. So
Yes.
But we're going to take a really quick break. You guys don't go anywhere. You have comments. I see you guys on LinkedIn and also YouTube, Facebook. Thank you guys so much for being here. You have questions for my guests. Miss Ebony Tinsley, I want you guys to put them up there in the comment section. So don't go anywhere. We'll be right back. Okay? Hang tight.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
All right, if you guys are just tuning in to the You Didn't Get the Memo show, my awesome guest, Ms. Ebony Tinsley, who is a physician assistant certified, we have already covered a plethora of things right now, and still there is more to come. Before we went to break, one of the things that I alluded to is talking about Roe versus Wade, because you've had quite a bit of experience, and I'm certain as it hit so many other people within the medical community, that something we want to talk about. But before we do that, I did have a question from one of the viewers. They are asking, see if I get it, as a veteran, then why does a PA determine if the diagnosis that an MD made for is valid as it applies to VA ratings? Al, I hope I'm getting that correct. Does it mean then why does a PA determine if the diagnosis that an MD made for is valid? So I'm not quite certain. We need a little more clarification on that. So let's see if he'll get back to us on that. Okay. So in the meantime, let's talk about Roe versus Wade. Something that has been on the books, 50 years?
Yeah, 1973, I think, is when it went into act, and it was, there to provide legal services, abortion services for women. Prior to that, in 1972, there was an uptick of about 39 abortion deaths because women were having them done illegally. And then once they passed this bill, then they noticed that the amount of deaths due to abortive methods decreased, and they only had about 2 deaths within the year. And I think that when we focus on the current climate and change, we need to understand how it's going to affect everyone as a whole. Currently, there are 13 states that have greatly restricted access to procedural abortions. And those states include Idaho, Utah, Wyoming, North Dakota, South Dakota, Oklahoma, Texas, Arkansas, Louisiana, Mississippi, Kentucky, and Missouri. Now, there are a handful of states that are also leaning towards that. So what does that mean for women in reproductive health services? that means that women are going to have to travel farther to get those services should they need them. I believe the two Planned Parenthood locations within the state of Texas have relocated to several miles outside of the state of Texas. And so just within that small radius, those women who are receiving care or were receiving care from those facilities now have to find the financial means to get that reproductive health care out of the state. So it's definitely going to cause an uptick in financial constraints for women, especially African American women, who are 2.9 times more likely to have maternal rates where it ends in death. And this is in comparison to white counterparts and Hispanic women as well. Now, in regards to how does that affect other states who are allowing abortive procedures, that means that they're going to have an increase in demand, which means that you need to have an increase in the healthcare providers that provide those services. At this current state, primary care is already being stretched thin. So when we think about providing those services and getting patients in and accessibility, it is really going to be a challenge in these upcoming months to years with women seeking reproductive health and health care. And abortive treatments are not just used for women who do not wish to have go through with a pregnancy. It's also used for women who have ectopic pregnancies, where the risks of having of not doing the abortion is the death of the mother, or there is or the fetus is not going to live past a certain age, or there's any sort of health concern there, then that's when abortion is also used. So I think that we're going to see a lot of changes, and especially in primary care, we're going to see an increase in demand for these services, which means that we need to have an increase in our workforce of providers that can provide these services in the states where it's legal.
Yeah, I was struck by the fact that this would even be an issue, and the things that you talked about, and I think I shared with you prior to us streaming live. I'd spoken with a really good friend of mine who's been an OBGYN for years, and one of the things that he did voice was a concern was he came along when women were having abortions where they were using coat hangers, and of course they were predisposed to infection. So many women died, and it's amazing that we would have males who are making decisions about our bodies, but not thinking past that. Just what you said, ectopic pregnancies. What about the young girls that are raped, molested, or a woman for that matter? Should she be made to have a child? And those are some of the things that I think, even for you as a clinician, would have to deal with in talking to these people. And that's not an easy decision to make. Let me just say this. I don't think any woman who decides to have an abortion just says, oh, I'm going to have an abortion. I'm pregnant. I'm going to have an abortion. It just doesn't work that way. And it does concern me that our healthcare system is already burdened. And now we've got to deal with this. And it's amazing, y'all. This is why you need to vote and pay attention to those people
Absolutely.
who voted to change these laws. You can't force someone to have a child, so because you want to increase the population as it relates to your own ethnic group, because that's literally what it amounts to. And in my opinion, let me just say that, in my opinion. But at the same time, it is one for concern. And having to travel to have an abortion, I read a post that someone said, well, if that's the case, then child support should start at inception and continue, you know, through
Yeah.
age 25, 26. And that leads me into, I'm going to talk about, let's start with men and men, having vasectomies. So, can you share with us what, you've seen, what the literature is saying? Because I can imagine that a lot of men who were going out and just having sex for fun have now realized, I may be a daddy and I'm not ready. So, talk to us about, vasectomies. Are they reversible? Are they not? Things of that nature. What's the ins and outs as it relates to vasectomies?
So, in regards to vasectomies, and I just read an article in the Washington Post where urologists had seen an uptick in the demand for vasectomies roughly about 2 weeks after the overturning of the Roe versus Wade, and I think it was somewhere in like 300 to 400%. Vasectomies are reversible. And so, if you have the male who gets that done, the urologist can both perform and reverse the procedure. In regards to a woman and sort of like tubal ligation, there are instances where a woman can have that reversed as well. However, that is not a guarantee. As we've seen in medical literature, there are instances where there is damage to the tubes, and so it cannot be reversed. There's also a financial cost with it. So I think the fact that now we have men getting more vasectomies will sort of help in our own having that independence in our own reproductive health. There's also companies that are now doing trials on male birth control, which is also in our alternative. And speaking of birth control, which is really important, a lot of these states that are banning the Roe versus Wade are also banning contraceptive methods such as oral contraceptives, IUDs, things like that. Just because of this whole overturning and these rules and what those contraceptive methods entail. Now, with that being said, that makes it harder for a woman to have that sort of independence and that knowing that she is in control of her own health rather than some government entity invading on how she gets her contraceptive methods or what she chooses to do with her body. It definitely is an infringement on our personal health and women's personal health. There's a reason why we have HIPAA laws that you can't give out a person's medical information without their consent. You can't do any sort of medical procedure without a patient's consent. And so now you have this rule that basically decides what treatments a patient can no longer have. And so it's really going to be an interesting thing to see in the upcoming months as well as years with this new law in place.
Yeah. And every woman listening to this, and all you men, you should be incensed, because those of you men who have daughters, and you can't, I mean, birth control, and can I just say, drop this in here? One of the things that just gets to me is when they keep talking about, oh, Walmart and I think it's Google, and they'll pay for a woman to have an abortion. I'm thinking, again, you talk about HIPAA. So why would I want my employer to know that I'm having an abortion? Because there are so many other people, because that's statistics that they're going to keep. How many of our employees had abortions? And the fact that you can't get birth control pills. That to me it takes us back to the 1900s when women didn't have anything, right? And
Yeah.
they just had, that's why so many women, 10, 12, 14 babies. It's amazing to me, and that just infuriates me that you're saying they can't get the morning after pill, so they can't get birth control. and they can't have any type of even sterilization at this point. They just want you to get pregnant. And here's the question: the government's not, it's not a question, it's a comment. The government's not even taking care of all the babies that are in the system as it is. So what would make them think that doing this, and this is for all you Congress people, all of y'all, you know what, I'm just telling you, just supplying people with diapers and some milk
Yeah.
and juice, it is not enough. And raising a child right now, on average, one child is roughly about $40,000 or better a year. And that's not even including those that are in, middle school, high school, college, that type of thing. So that infuriates me to even know that this is being done. I mean, this is 2022.
Absolutely. And, just me being a young woman, it scares me for when I decide to have children. And I'm constantly talking to my young patients
Mhm.
about, education, which is one of the things. I went to a conference. It was the National Reproductive Health Conference here in San Francisco. It was August 9th. And so it was through Title 10. And basically, we discussed a lot about the changes with reproductive health
Mhm.
services
Mhm.
and how a lot of implementation needs to go into reproductive health education. Um, when I was in school, there was sex education. You talked about it, people understood, they knew about their bodies. I think that that has sort of gotten out of the schools and
Right.
it's not so much talked about. Some young women don't even understand how reproduction works, understand about their
Absolutely.
bodies. And so I think we're doing a disservice to our young women by not educating them on certain things that are just natural processes within their bodies.
Right.
And I think if you don't provide patients with enough education, then how can you provide them with options that they can choose from?
Mhm.
Um, so the medical community is, especially within primary care, we're really pushing to help solve what may become a detrimental problem within reproductive health.
Right. There's no question. And I do want to say, if you grew up like I did with, grandparents and parents who are moms who are saying, if you kiss a boy, you can get pregnant, right? So just think about a lot of these girls now who think that they are hip and they know it all, but they really don't know. And that is of a concern for me. But I want to go back to one of the questions that our viewer asked. What his question was is how, okay, wait a minute. Let me get you. You had several. Okay, so he was talking about the rating that he gets as a veteran, that
Okay.
the VA sends the veteran to a physician assistant to validate the medical diagnosis that was given by a doctor, an MD. And he was asking, in your opinion, is that a normal process in the medical field?
So that is interesting because that's my first time hearing about that. And I'm not familiar with how the VA services, how their process works in regards to disabilities. I am licensed to do Department of Transportation physicals for like truck drivers and things like that. And there's certain requirements that we have to go through in regards to that. So I'm not familiar with that. So I'll research that and look that up and get back to you.
Yeah, yeah. Well, you know what? One thing I would say to Mr. Rogers is, look, think about it like this. If they're going to send you to see a PA after you've seen an MD, that tells you that they have more belief in the PA.
Yeah,
I'm
absolutely.
just saying, I'm just saying. But also, we have a couple of other comments. Okay, so let's go with this one. Mr. Rogers was also asking, how does the Roe versus Wade decision affect the medical care that a MD or a PA can provide? And you basically alluded somewhat to that. So I don't know if you want to expound any more on that, because you're still giving the level of care that you've
Well,
been accustomed to.
exactly. And so I still do well women's exams. I still prescribe oral contraceptives. I'm trained to do implants as far as Nexplanon, IUD placements. I can do that for women. But that's just here in the state of California. So it really depends on your state. And again, if you're in those 13 states where they have banned any form of contraceptive methods, whether it's abortion, morning after pill, oral contraceptives, then it really limits what you can provide within the realm of your state laws. I would be interested to see how that comes about in the next year. But at this point, I'm still able to provide those services to the women that I see as patients.
Mhm. And that is why we live in California.
Yes,
But
absolutely.
we have one comment, though, just a comment from Mr. Briggs. He says he thinks it's completely ridiculous to tell women that they don't have full autonomy over their body to make the personal choices that they need to make over their own reproductive health. Because he did a second, in terms of choices for their reproductive health. And I 100% agree with him. I'm pretty certain, I don't want to speak for you, but that's probably your thought as well. I mean, we live in a world of being able to make choices.
Absolutely. And that's all a part of healthcare and primary care.
Mhm.
We do something called shared decision making,
Mm.
where I educate the patient after I've taken my history, do my physical exam. And then I say, hey, well, based on what I've found in your current medical history, these are some of the options as far as treatment. And then the patient and I decide which treatment option is the best for them and which one they're able to follow and makes the most sense. Now that you're unable to have that in certain states where it's like I don't even get that shared decision making with my OBGYN in regards to when I want to have a child, how I want to have a child, those sort of things, it does take away from that patient's autonomy and independence to make decisions in regards to their health choices.
Mm. Okay. All right. We're going to take another quick break, but we're gonna switch from this, you guys, to the viewers who are watching. And look, we're going to get into something that I think that's really important as well. And I when we come back, I'd like for us to talk about vitamins and prescribed medication, because I heard something, in regards to certain supplements that you take, and you're taking it by mouth, and you really need to be taking it in like a tea form and those kinds of things. So you guys, this is good stuff. This is why we provide you with relevant, fact-based mainstream information to help you be informed and to make informed decisions. So don't go anywhere. You got questions, place them in the comment section, and my awesome guest, Miss Ebony Tinsley, we'll do our best to get to you. So, guys, don't go anywhere. We'll be right back.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man. Women, 0. 3 more fingers if you're over 60. 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
All right. If you guys are just tuning in, we're having just a real dynamic discussion around everything. I was saying to Miss Ebony that my mom used to always say, we're talking about everything from the rooter to the pooter, from the so, when you think about it. And so we kind of covered the whole, Roe versus Wade, and, we could go on and on about that, right? But I want to make sure that we get to the piece about vitamins and supplements, because one of the concerns, and I just know for myself, and at the time with my parents when they were living, uh, y- you know, they're taking all of these different supplements, and yet they're also taking prescribed medications. So they're doing the over-the-counter vitamins and stuff, and prescribed medication. And let's talk about what the potential for interaction is. And in your opinion, what are probably the 3 or 4 main supplements that patients should be looking at and taking?
Absolutely. And that's great that you asked that question, because I'm always asking my patients, outside of your daily medications, are you taking like a multivitamin, any sort of supplements? Typically, what I would recommend is for patients to talk with their primary care providers, and do some blood tests to see if there's any sort of vitamin deficiency. A simple blood test can see if you're deficient in sort of vitamin B12 or folate, as well as any sort of vitamin D deficiency, calcium, magnesium, any of those supplements or vitamins that you're deficient in can be supplement. Now, one of the caveats to that is that the over-the-counter supplements are not FDA approved, meaning that they have not gone through the standard Food and Drug Administration requirements. So if some company says like this has 81 milligrams of calcium, there is no test that has been done to state that it has exactly that many milligrams. So that is why blood tests are needed. So first you want to get a baseline with your provider to see what vitamins you're deficient in. Then you want to start taking supplements. Any sort of vitamin D deficiency, which is common among African American population. We tend to be vitamin D deficient. Anything under 30 is considered vitamin D deficient. So you want to be in that 30 to 100 range. And typically, if you're under 12, then we start you off with 50,000 units of vitamin D once a week for 8 weeks. Then we retest to see if you're back in that 30 to 100 range. After you get into that 30 to 100 range, then the next step is to do the maintenance, which is usually 2,000 units of vitamin D daily. Typically 2,000 units of vitamin D daily during the summer months, so spring and summer when it's more sunlight, and then in the winter months doing 4,000 units. Now, in regards to vitamin D and calcium, that's when we get into the postmenopausal women population, and we're talking about bone loss, osteoporosis, osteopenia. That's when you want that postmenopausal woman to be taking 1,200 milligrams of calcium and maybe 8,000 units to 1,000 units of vitamin D. Calcium and vitamin D work symbiotic. So they have a very good relationship. And so that is what helps women get from being osteopenic to osteoporotic. And so osteoporosis, meaning that you have severe bone loss, making you more susceptible to fractures, hip fractures being really important in that realm. But I would say getting a multivitamin daily is really important. There's also other things that people take. So people with cardiac issues may take like a magnesium supplement, which is definitely beneficial, roughly about 250 milligrams of magnesium a day to help with heart health. There's also zinc for immunity, vitamin C. But really, it's about working with your primary care provider to see what you're deficient in, what you're lacking. If you're not getting it organically through the foods you're eating, then you definitely want to supplement with some sort of oral, sublingual medication that can help increase those vitamin deficiency numbers.
Right. Now, I'm just going to ask you your blurb, your thought. The
Yes.
craze right now is turmeric, right? And
Yes.
turmeric's all over social media. Turmeric is I go into Costco, just shelves of turmeric. And I'm like, didn't I hear that, just taking turmeric orally like that, it really doesn't work. So what are your thoughts in regards to turmeric? Everybody's
Yes.
taking turmeric.
Absolutely. So turmeric is used to help decrease inflammation, which is why a lot of patients take it. But the medical literature states that it is most effective when it is heated. So if you are taking a turmeric supplement and it's in the pill form, there's a good chance that you're not getting the benefits of that turmeric property, that anti-inflammatory property. Turmeric, to be effective, it has to be heated. So turmeric tea, some patients will drink that, having it in like a soup, things like that. Those can be beneficial. But if it's not heated, chances are you're not getting the effectiveness of the anti-inflammatory properties.
Okay, so real quick, we have another question from one of the viewers. They want to know about cleansing detox. Is it a real thing? And if so, do you have any suggestions for any of them?
So there are some detox things out there. And I do recommend that patients detoxify their body on a regular basis. One of my professors used to say the solution to pollution is dilution. So I'm always encouraging my patients to drink at least 64 to 72 ounces of plain water a day. If you're not getting that in, your body loses 3 liters of water a day, and that's just from sweat, from urination. So if you're not replenishing that fluid back in your body, then you're underhydrated. So 50% of your blood needs water, is made of water. So water has a high functioning property for us. So I think just increasing your water consumption daily is just a natural way to detoxify versus using something that you would get at GNC, like a 3-day detox. But I do think that doing at least, if some people do it like every 3 months, they do just like a big detox cleanse. And that means not drinking alcohol, not consuming any sort of fried foods, fast foods, things like that, which can be healthy because it resets the organs and it allows them to function properly. But again, I'm a big pusher on water. If you're not drinking at least 64 to 72 ounces of water a day, you're probably underhydrated.
Yeah, notwithstanding some of you who are probably predisposed to hemorrhoids because they're not getting enough fiber in their diet, they're not drinking the water that they
Absolutely.
should. And now you've got a whole nother set of problems on your hands as well. I'm from the South, and so one of the things we always knew, in the fall, you're going to get a big healthy dose of castor oil, whether you liked it or not. And we used to hate that. But now growing up, and you look and you go, oh my goodness. And I think that just what you said, we're not replenishing the water. That our body is losing, which is probably why a lot of people, myself included, uh, get leg cramps sometimes. And so that causes a problem. So those are the things. I'm glad to hear hear you say that. So detox. Okay, Dr. Tinsley, I'm going to be on the detox bandwagon here. Look,
I'll be checking on you. I'll be like, Gloria, did you get your 64 to 72 ounces in today?
I know. Well, look, I've already down 32 plus 10, so that's 42. So I'm getting there. I'm getting there, and that's not counting alcohol. Okay.
Plain water.
Plain
Plain
water.
water.
That's it. Straight up plain water, not even with lemon in it. But let me switch gears because we want to get to this one of the topics. Let's talk about Black women and fibroids. Fibroids is real, and it's very, very real. And for Black women, it just seems like lately I've run into a lot of women, and they say I've got to have surgery. I got fibroids, and I'm thinking,
Yeah.
what is going on? So can you kind of like give us the skinny about what's happening with Black women and fibroids?
Absolutely. So as a personal story, I had fibroids, had my surgery earlier this year to remove them. My mother also had fibroids. So one of the things is there's this genetic component that predisposes women to fibroids. The percentage is 80% of African American women will have fibroids by the age of 50. 70% of white women will have fibroids by the age of 50 as well. What they're seeing, though, is there's an increase from the time that you're 30 to 35. So from the age of 18 to 30, there's about a 6% chance that women will have fibroids during that time. And then there's sort of this uptick by age 35, where you're at a 60% chance of having fibroid. Now, understanding fetal maternal medicine, one of the things is that age 30 and older is considered advanced maternal age. Now, does that play a role into a woman developing fibroids? It's unknown. A lot of it suggests that it is more of genetic base, but we are seeing a disparity among Black women and white women in regards to the percentage, the higher percentage being in African American women. I haven't delved deeply into the research as to what causes them. I do see a lot of patients who are experiencing that, and roughly within that age group that it talks about, between 30 and 35, where we're seeing this uptick. Symptoms that you see with uterine fibroids: heavy periods, heavy prolonged bleeding during menstruation. Usually women will complain of a lot of pelvic pain during their periods, a lot of clotting, feeling significantly fatigued. Women can even become anemic. Iron deficiency anemia can occur during these times because of the heavy blood loss. Now, there are surgeries that are both open procedures and both laparoscopic procedures to remove the fibroids. There has not been any confirmed study that has shown that any oral medication decreases the fibroids. Usually, if a woman is having heavy menstrual cycles due to fibroids, she can get something like an oral contraceptive that will help control the bleeding, but really the removal of those non-cancerous tumors are really what's going to be the ultimate treatment.
Mm. Okay. Oh, thank you so much for that. That's really, really important to know. And I'm going to say to you, the viewers who are watching, and those of you who are normally on here and not, guys, be sure and share this information. It's vital. If we don't take care of ourselves, nobody else is going to do it for us.
Absolutely.
And so we need to definitely make sure that we take care of ourselves. Dr. Emily, we're going to take like a really 30-second break. We're going to be right back. And I want to give you time to kind of, as a chew on this a little bit,
Absolutely.
what do you want people who are watching the show to take away? And at the same time, can you tie in, some preventative things for, the viewers in relationship to their health? So I'm kind of asking you to do two things in one.
Absolutely.
The time always flies, as I told you.
I know, when you're having fun.
Right. So, guys, don't go anywhere. I see that we have another comment, and I'll get right back to you guys, but just hang with us, okay? Another 6 minutes. We'll be right back.
Thank you for watching the You Didn't Get the Memo show. with your inspirational host, Gloria Bailey Ray. It's your contributions that make this happen. To become a sponsor, send an email to youdidn'tgetthememo@gmail. That's the letter U, didn't get the memo. If you're not in a space to be a sponsor, but you like what you hear, we simply ask that you support what you like by making a contribution to the show. There are 3 ways to make an online donation. Visit paypal.me/Gloria Bailey Ray or Cash App or Venmo, Gloria Bailey Ray. Give what you can. Your support is appreciated.
Okay, you guys, that was a quick blurb. And of course, let me just tell you, your support really does help. It helps with buying equipment. It helps with, my goal is to get into a space. And so guys, look, every little bit helps. And I really hope that you are all being helped by the information that is shared here every week. 52 weeks, that's a lot of producing shows, you guys. So I was tired at times, but because I believe in getting the word out and educating people, and I think that that's important. Before we went to break, I'd asked Dr. Ebony this question. Actually, it was 2 rolled into 1. What does she want people who are watching the show to take away from today? But also, if she could give us some, tidbits around preventative care in relationship to your health care. And Emmanuel, I saw that comment. So check on me. Now I'm in the hot seat. So I'm shooting for 64 ounces. I don't know if we'll get to a gallon, but much love to you for sure. So Ebony, what are your thoughts?
So just kind of 3 key points. Get your annual physical. Your annual physical that you have with your primary care doctor is so important. That's where we really just take a holistic view at what you need to do for the upcoming year for your health. That's where we get you your colonoscopy, your mammogram, we order your labs, all of that. Your physical is so important. Just like getting your routine dental cleaning, eyes checked, those are really important as well. Another thing that I would say is when you're going into your primary care's office and you are coming there with certain concerns, have a list of roughly about 2 to 3 things that are really important that you want to talk about. A lot of times patients come in and they have a laundry list of things that they want to talk about, and we don't end up touching on the most important things. And so I would really encourage you to have a list of roughly about 2 to 3 things that you really want to talk about. And then my last thing, as far as preventative health care, it is really important to do at least 30 to 40 minutes of physical activity 3 times a week, in addition to drinking 64 to 72 ounces of water. If you just start there in regards to getting your health back in order, I promise you'll see different results. So the solution to pollution is dilution, 64 to 72 ounces of plain water a day. And then getting those yearly physicals, those annual physicals can really help catch those underlying diseases and malignancies that may have been going on for years, but you just avoided the doctor or avoided going to your primary care's office. I hope that this was very informative for you. And I thank you, Gloria, for having me on this show. This was truly a pleasure. It was good to see you again, too.
Oh, I know. I promise I'm making it a point to really stay in touch with people and, just connecting. And that's the thing. So don't you go anywhere. I'll be right back to you. I want to, first of all, say to all of you that are tuned in, I want to thank my guest, Dr. Ebony Tinsley, so much for being on the show. It is my hope that you have found the information that she has shared to be educational, to be informational, and inspirational to you guys. I want to ask all of you to be sure and follow me on all my social media platforms. That's not only Facebook, YouTube, don't forget to hit follow, right? LinkedIn. I'm also on Instagram as the Authentic Coach. But mark your calendars for every Tuesday from 5 to 6 p.m., guys. 1 hour for you to get some of the best information that's out there. I know it, I believe it. And so that's the thing. We always have a really, really great show. I'd like to say to you, you won't be disappointed. Please take to heart the information that you've heard today. And I always say this, if you didn't take anything away from today's show, then it's really you who didn't get the memo. I'm your host, Gloria Bailey Ray. I want you guys to go out, to stay safe, to know that you are truly blessed, pay it forward, and know that I love you all and I'm so grateful to each and every one of you. God bless. Until this time next week, I'm out.